So there's a version of aging that most people don't really think about until it's already happening to them. Not cancer, not heart disease, not dementia, although clearly those things matter enormously. I'm talking about something quieter, much more subtle, which is the slow, gradual loss of the ability to do the things that make life worth living. Even simple things like carrying your own shopping, getting up from a chair without using your arms, climbing a flight of stairs without stopping. These sound really trivial until they're not trivial anymore, until they're the difference between living independently and not. And the biological process underlying most of that loss begins decades earlier than most people realize. And protein sits right at the center of all of it. I'm Dr. Alex, here to help you to live longer and to prevent the end-stage diseases that I see every day in the emergency department. And if I can ask just one thing before we get started, it's to please check that you subscribe to the channel. 3/4 of you who watch these videos aren't yet subscribers, and clicking that button really does help to keep everything moving in the right direction and helping these videos reach more people. So what I want to talk about today is protein, but not in the way that it usually gets discussed. I want to talk about it as a clinical matter, as something with direct, measurable consequences for how long you live and how well you live. Because the gap between what most people are eating and what the evidence actually says is massive. And a lot of people don't really have any idea about that. So protein is the structural and functional material of almost everything inside your body. Your muscle tissue is around 80% protein by dry weight, but so is collagen. The scaffolding of your skin, your tendons, your ligaments, your hormones, insulin is actually a protein as well. Your immune system, antibodies are proteins. The enzymes that digest your food, the molecules that repair your DNA, the transporters that carry oxygen in your blood. All of those are proteins built from around 20 amino acids that your body is constantly assembling and disassembling at a scale that is genuinely difficult to comprehend. Millions of protein molecules per second, continuously, for your entire life. And the critical thing about that continuous process is that it requires a constant supply of raw material. When dietary protein is inadequate, the body doesn't just pause construction, it starts cannibalizing. It starts breaking down muscle tissue to harvest the amino acids it needs for more urgent biological priorities. The muscles are essentially the body's amino acid reservoir, and when you're not supplying enough from your diet, the body draws on that reservoir instead. Now that's fine as a short-term emergency measure, but as a chronic state, which is what inadequate protein intake over years produces, it is slowly, quietly dismantling the very tissue that determines your functional capacity as you age. After around the age of 30, we know that your muscle mass declines at roughly 8% per decade in people who aren't actively doing anything to counter it. Now, it sounds modest, but if you compound that over 40 or 50 years, it clearly isn't. By the time somebody reaches their 70s or 80s, having never prioritized resistance training or adequate protein intake, the cumulative loss can be absolutely severe. And this actually has a name. It's a condition called sarcopenia, which is defined as pathologically low muscle mass and strength, which is associated with falls and fractures and loss of independence and also death. And I've seen the end stage of this in the A&E countless times, and it's not something that you can just sort of ignore as you get older. This is an elderly person who falls in their kitchen and can't get up and spends hours on the floor before anybody finds them. It's the inability to recover from a hip fracture because there isn't enough muscle reserve to drive rehabilitation. It's the physiological fragility that turns a manageable illness into a life-threatening one. A large study published in 2018 looking at over 4,500 adults aged 50 and above found that low muscle mass was associated with a 40 to 50% higher risk of all-cause mortality over that following decade. This is huge. And importantly, it was muscle strength, so functional working muscle, not just muscle volume on a scan, that drove the association. Now, to give that number some context, Metformin, which is one of the most widely prescribed medications in the world for type 2 diabetes, there's a chance that you know multiple people who take this medication. This reduces all-cause mortality risk by somewhere in the region of 15 to 30%. And so we're talking about an effect size for maintaining muscle mass that seems to be bigger than that of one of the most powerful drugs and one of the most common drugs that we have. That is not a comparison that most people have ever heard, and I think it should change how seriously we take this. The current recommended daily intake for protein in the UK and the US sits at around 0.8 grams per kilo of body weight. For a 75 kilo adult, that's about 60 grams a day, achievable with a couple of eggs, some yogurt, and a portion of lentils if we're being super healthy. And for decades, this number has been presented as the target. But it isn't the target, it's the bare minimum, it's the floor, the minimum estimated to prevent clinical protein deficiency in a sedentary adult. It was never designed to optimize muscle maintenance to support healthy aging or account for the progressive anabolic resistance that develops as we get older, this phenomenon where older muscle tissue becomes less efficient at using dietary protein, meaning that older adults actually need more, not less, to achieve the same biological effect. The evidence that's come out over the last couple of decades or so consistently points towards 1.6 to 2 grams per kilo of body weight as the target for adults who want to maintain muscle mass and support healthy aging. For a 75 kilo person, then that means 120 to 150 grams of protein per day, roughly double to triple the official recommendation. That is a significant gap, and closing it matters not just for muscle, but for satiety, for glucose regulation, and for your metabolic health more broadly. There was actually a paper that looked specifically at older people and concluded that eating at least 1.6 grams per kilo per day was necessary just to prevent muscle loss, not building muscle just to stop losing it. Double the official recommendation just to stay at that level. And that tells us something really important about how outdated this current guidance actually is. This is the section that I think surprises people the most because it reframes something that most people experience as a personal failing, which is overeating, constant hunger, and cravings that never really go away, as something that is actually a physiological response to the food environment that we're living in. And it connects directly to protein in a way that I think is really underappreciated. So there's a scientific framework called the protein leverage hypothesis, developed by two researchers called David Raubenheimer and Stephen Simpson. And what it proposes is this. The body has a specific protein target it is trying to hit, and it will keep driving hunger until that target is met. Not a calorie target, a protein target, which means that if the food you're eating is low in protein relative to its calories, which is exactly what most ultra-processed food is, your body will keep pushing you to eat more of it in an attempt to extract the protein that it needs, even if you've already consumed far more calories than you actually require. It's really interesting, and not many people have heard of this. Just think about what the majority of ultra-processed food actually is. It's industrially formulated. It's white bread, crisps, biscuits, breakfast cereals, snack bars, ready meals, pizzas. These products are predominantly refined carbohydrates and fat with relatively small amounts of protein. They're calorie dense and protein poor, and enormous amounts of food science has actually gone into making them as compelling as possible. The specific texture, the salt to sugar ratio, the mouthfeel, all optimized to make you want more and spend more. So we have a food environment that's engineered to be irresistible, that is structurally low in the one macronutrient that your body is actually seeking, and this biological drive that will not switch off until the protein deficit is filled. The result is that people are eating far more calories than they need while simultaneously being undernourished in protein. Now, that is not a willpower problem. That is biology operating exactly as designed in an environment that it was never designed for. And the straightforward implication of this is that increasing protein intake Prioritizing it at every meal tends to reduce overall hunger and calorie intake almost automatically, because you're finally giving the body what it was looking for in the first place. So let me just paint you a picture of what this sort of looks like in practice. So in emergency medicine, one of the most common patients I look after is the older adult who comes in on a big long list of medications. 8 drugs, sometimes 10 or 12. Something for blood pressure, something for blood sugar, cholesterol, joint pain, and then something to protect the stomach from the side effects of the joint pain medication, and then something for low mood, something for sleep. Each drug managing a symptom or a number, often without even touching what actually produced that symptom or number in the first place. This is what we call polypharmacy, and it's honestly one of the most defining features of how a huge number of people spend the last decades of their lives in the developed world. Now, I'm not saying that all of that is purely a protein problem. Obviously, that would be very simplistic, but inadequate protein over decades combined with not doing enough resistance training, poor metabolic health, the kind of diet that keeps insulin chronically elevated and then drives systemic inflammation, that combination contributes directly to the trajectory that ends there. Muscle loss reduces insulin sensitivity, which drives metabolic dysfunction. Metabolic dysfunction leads to type 2 diabetes and cardiovascular disease. Loss of strength and functional capacity means that you move less, which accelerates everything else. And at each stage along the way, another drug gets added to manage whatever the latest manifestation is of a process that was years, sometimes decades in the making. The people who tend to arrive in their 70s and 80s on fewer medications with better functional capacity, who bounce back quicker when something goes wrong, they're almost universally people who kept their muscle mass, who stayed physically strong and ate in a way that supported their metabolic health across the preceding decades. That's not luck, that is their biology, that is them stacking the deck in their favor. And protein is one of the most fundamental inputs to that biology. Not a supplement, not a pill, but food, specifically enough of the right kind, consistently over long enough that the compound effect can actually do what compound effects do. So practically speaking, how do you actually get 1.6 to 2 grams per kilo of body weight per day? The honest answer is that it takes some intentional thought, because it doesn't happen by accident on a typical Western diet. So animal sources like meat and fish and eggs, dairy, they are the most efficient in terms of protein density and amino acid completeness. Oily fish, eggs, Greek yogurt, chicken, red meat in moderation, these provide what's called complete protein, meaning that they contain all of the essential amino acids that your body can't make itself and has to get from food. Now, plant sources are important and genuinely valuable, but they tend to have lower concentrations of certain essential amino acids. And I'm talking about lysine and methionine particularly, and the protein is often less bioavailable, so a lower proportion of what you eat actually gets absorbed and used. Now, that doesn't make plant protein inferior necessarily, and a plant-based diet can absolutely meet your protein needs, but it does require a bit more thought and a bit more variety to make sure that you're covering all the bases. So tofu and lentils and legumes and peas and beans, those are the higher protein plant options worth building meals around if you're not eating animal products. And something else that's worth mentioning is that how you distribute that protein across the entire day matters enormously as well. So there seems to be a ceiling on how much protein a single meal can actually direct towards muscle protein synthesis, somewhere around 40 to 50 grams, although clearly that varies with age and your body size. So eating 150 grams of protein in 1 or 2 sittings, and you're probably doing that with a protein shake, is considerably less effective than spreading it across 3 or 4 meals. A protein-anchored breakfast is probably the single most impactful meal-level change that most people could make. Not just for hitting your protein numbers, but for how your appetite behaves for the rest of the day. So try starting your morning with eggs or Greek yogurt, the 10% kind if you can get it, or smoked salmon or cottage cheese, rather than just toast and jam or cereal, because this creates a completely different hormonal and hunger trajectory for the following 8 to 10 hours. And given what I said about the protein leverage hypothesis earlier, that your body will keep driving hunger signals until its protein target is met, front-loading protein earlier in the day is one of the most effective ways to get ahead of that, rather than spending the rest of the day sort of chasing it. I hope that makes sense. So let's talk about the strength training side of all of this. So protein intake and resistance training aren't really separate conversations. They are two halves of the same thing. So protein gives you the raw material, resistance training provides the stimulus. Without the training, extra protein doesn't really do much for muscle. Without enough protein, the training can't drive the repair and growth it's supposed to produce. The mechanism here is pretty straightforward. When you load a muscle, when you push something or pull something hard, you create microscopic damage to the muscle fibers. The repair process rebuilds them slightly thicker and stronger than before, and that's how muscle is built. And it's available to everyone, not just young men in gyms, not just athletes. The research consistently shows that resistance training produces meaningful gains in muscle mass and strength in people in their 60s and 70s, even their 80s. The capacity for adaptation doesn't disappear with age. If anything, it becomes more important. Now, 2 resistance training sessions a week, and this needs to be compound movements that load multiple muscle groups at once, like squats and deadlifts and rows and presses. This, combined with adequate protein, is enough to meaningfully push back against that age-related decline in muscle mass. Now, that's a pretty modest commitment relative to what it protects, and the benefits go well beyond just muscle. So resistance training, we know, improves insulin sensitivity, it reduces your visceral fat, it strengthens your bones, it lowers your blood pressure, and it produces something called BDNF, which is a protein that drives neuroplasticity and is one of the most potent biological inputs to long-term cognitive function that we know of. So what does this look like over an entire lifetime? The protein conversation tends to get framed as a performance question. How do I build muscle? How do I look better? How do I recover faster? And those things matter, but the more important framing, the one that I want to leave you with, is what the trajectory actually looks like across decades. Muscle mass in your 40s and 50s isn't just relevant to how you feel right now. It's capital, it's biological reserve, it's what determines your functional capacity in your 70s and 80s. The research on this is really consistent. I've mentioned it so many times. Grip strength in midlife predicts mortality risk decades later. Muscle mass in your 50s predicts whether you'll be able to live independently in your 80s. The decisions made in the kitchen and the gym today aren't just today's decisions. They are compounding slowly and quietly towards an outcome that will either look like independence and strength or frailty and dependence. The framing I always come back to from emergency medicine is this. In nearly a decade working in the emergency department, I never once looked after a patient who was too strong, too well nourished, or had too much muscle. But I have looked after lots and lots of people whose outcomes were directly shaped by the absence of those things. Frailty isn't inevitable. Don't let anybody tell you that. Just because you're getting older, frailty isn't inevitable. In many cases, it's a nutritional and lifestyle deficit that built up over years, but was never addressed. Protein isn't just a bodybuilding supplement. It's one of the most important determinants of how you age. And most people aren't eating nearly enough of it.